Let's give 1 minute for everyone to join. I can see the numbers coming. Okay, so first of all, welcome everyone to this webinar. I hope that you all are healthy and safe in your homes. And today we will talk with another event about the pandemic. So today is the 8th event on the program of Respond Pandemic, and we will talk especially about young pharmacists. I hope that many of you who are joining today are young pharmacists, and I hope that you all are all inspired by these great names that you have today that will show what they are doing, and in special, what are the young pharmacists group doing around the world. This is both for young pharmacists and also for young pharmacists, scientists. So welcome again, everyone. So let me introduce myself. I'm Lucas. I'm from the Young Pharmacist Group from FIP. And as an individual, as a pharmacist, I work for Premier Agence International. And I will be your moderator for today. And this webinar is part of an entire series from FIP to work and to discuss about COVID-19. So we want to provide you the information about the pandemic and what the pharmacists and we want to share and discuss the strategies that all the leaders worldwide are doing. So especially for today, the young pharmacist leadership. The series also discuss about the sector and the implications of the area, innovations, everything that is coming into science, practice, and education. We want you who are joining here also to feel motivated and we want with the series to engage you to work and to know more about the different realities around the world with the response on the coronavirus. We want to discuss the implication, safety, supply, shortages. The topics that we have, they are multiple, and you all are welcome to come here and to collaborate. We want to consider the impact on the patients, and then we are health professionals too. So how does it impact the patients across different ages, different social conditions around the world? And we want to discuss and think also about the treatments. And more important for us is that you can also have your own idea of which presentation to do. So if you come here, you are here and you listen to it and you are inspired, you have some great idea what to present, what could be discussed on COVID-19, please share an email with our colleague Lina at fip.org. This specific this webinar was also an idea of a young pharmacist, so your idea is also welcome. From FIP have already an information hub that you as a pharmacist can go and give a look on this. So there's a comprehensive FIP webpage containing all the resources. And those resources, they are multiple, they come all the time. It's really some vivid information that you can find. And you can also join a Facebook group and discuss with other pharmacists like us about the different topics that coronavirus brings to us. Okay, so some rules about today. First of all, the webinar is recorded, okay? And it will be available for you to check on fip.org coronavirus. You all can answer questions, so it will be open for you to ask questions in the end of the presentation. And again, we have the feedback for you is more than welcome. So you can talk about how you like, what you don't like about the webinars in general about FIP. We have some objectives today, okay? So with the young pharmacists, we want to discuss how the young pharmacists and young pharmaceutical scientists in the different levels of healthcare, they are responding to the pandemic. We want to know which different strategies or involvement and response that the young pharmacist groups around the world are doing. And the last but not the least, we want to highlight the opportunities, resources, platforms, and everything that you can find to build yourself during the pandemic. To help with this, we have some great speakers today. So I want to introduce you all of them. So first we have here Ahmed. He is from the International Pharmaceutical Student Federation. He's specifically from the Eastern Mediterranean Regional Office. So welcome, Ahmed. I'm very glad to have you here. We have Audrey Clarissa, who is the president from the Asian Young Pharmacists Group. And she will provide all that is from that area where everything started, and will bring us some great inputs for the board. So Audrey, thank you very much for joining us. We will have Catarina Nobre, who is from the Young Pharmacists Association from Portugal. She will also share the different things that are happening in Portugal and also give some European perspective on this. And it's very good to have you here, Catarina. Thank you very much for joining us. And then last but not least, we have Sylvester, who is also from a regional big part of a young pharmacist group in the Africa, which is a new growing organization for young pharmacists in Africa. Sylvester, thank you very much for joining us. And I will start with three main questions before opening to the public to also give their questions. So I will start. One thing, I want to know, but from you, the panelists in person, I want to know what is your individual role on the pandemic's response. So you, as young pharmacist, what are you doing for the pandemic response as a person and as a pharmacist? To start talking about this, I want to go in the alphabetical order that we just saw. So I will invite Ahmed to introduce himself and tell us what he is doing for the response. Ahmed, the word is yours.
Okay, hello everyone. Good day. I'm really glad to be here with you. Thank you, Lucas, for the great introduction. And I'm honored to be here with you, sharing with you some of the brilliant efforts that are being done by young pharmacists in the Middle East region. First of all, my name is Ahmed Rawaini. I am currently working as a clinical pharmacist. I graduated with Doctor of Pharmacy degree last year, and now I'm doing my PGY1 postgraduate year 1 pharmacy residency training. Last mandate, I was serving in the International Pharmaceutical Students Federation as the chairperson of the Eastern Mediterranean Regional Office, where I oversee and lead with regional working group the activities and the reports and the initiatives taken by those young promising individuals, pharmacy students and recent graduates in the Middle East region to promote their own development plus public health also development. Part of my duties as a clinical pharmacist working in the hospital sector as a frontline pharmacist, we deal with patients who are either suspected at the beginning and then when they turn on to be positive. So we deal with them on daily basis as part of our duties as a multidisciplinary team. We have the physician, we have the clinical pharmacist, we have the nurse, we have the respiratory therapist. We go on infectious disease consultation to a specific 2 and 3 floors in our hospital. We check them on daily basis. We monitor their treatment for safety, efficacy. We do also education for them when they get out of the their acute period of infection. We do education for them and for their families how to prevent further spread of the infection and how to also spread the message to the people around them. And definitely we take our own precautions while dealing with patients who are coming to the emergency department to check for their themselves. Also, our hospital and many hospitals in Lebanon, where I live, they go on missions to many areas to do active surveillance system to check for the cases before they come to us. So we go to them as a multidisciplinary and interprofessional team, and we do the PCR test for them, and we support them with medications when needed, with education. And this is an initiative that is being supported by the Ministry of Health and many also investors in the public health also well-being. Thank you.
Thank you very much for introducing yourself, Ahmed. It's always, when we see about the response, especially on the media, everything goes to the hospital. So it's very good to have you here to show us some perspective on the hospital pharmacist. Thank you very much. I will now move to Audrey. Please, the floor is yours.
Thank you very much for the opportunity. Let me introduce again. I'm Audrey Clarissa. I'm currently the president of the Asian Young Pharmacists Group. And regarding my individual role on the pandemic response, currently I'm also leading pharmaceutical manufacturing in Indonesia. So, my pharmaceutical manufacturing in Medco Jaya. So during the early COVID-19 pandemic, we were the only company that produced hydroxychloroquine. So in Indonesia, for the drug for repurposing drugs, we only have several products that are available. So we don't have remdesivir. So the only one that we have is hydroxychloroquine and also lopinavir, ritonavir. So we were working very hard to secure the supply, because at that time, it's not easy because hydroxychloroquine production is very limited, and we know that all countries are trying very hard to get the material. So we work to secure the supply. We also produce the products, and since we were the only one that produced the hydroxychloroquine products in the country, so we work very hard, including in the weekend and also in the holidays. We have to work to make sure that we have enough products for the country, and we also distribute throughout the nation, making sure that no hospitals or no pharmacists that stockpiling the products. But we need to make sure that every hospital that needs the product, they have available products in the country. So that's also one of the things that I was working to make sure that everything runs well. Also working together with the government to make sure that they have enough products for the country, because we were the only one that produced the product. As we know that chloroquine and hydroxychloroquine is used for rheumatoid arthritis, for autoimmune diseases, while for chloroquine it's used for malaria. But at that time, we know that Indonesia, I'm coming from Indonesia, we have resistance for malaria, so we no longer use chloroquine or hydroxychloroquine for that purpose. That's why that the product is very limited, and even our product was just approved last year. So that's the thing that I was doing in the beginning, and I'm still working on the production and making sure that the product is available. And we are also producing some other products like vitamin D high dose, which in Indonesia is considered as drugs, while for Europe or other regions it's considered as supplements. But because it's considered as drugs, only my company that also produce the high dose vitamin D. Now there's also some other company that also produce the products, but because the Indonesian FDA is making some relaxation and also create some fast track registration for the products. However, that is what we are preparing and making sure that everybody, including the healthcare professional, knows exactly how to use the hydroxychloroquine and also the vitamin D, so they can do it with the right purpose, and also making sure the safety issue is still one of the things that everybody has to know how to use the products in a correct way, according to the purpose. Thank you.
Thank you very much, Audrey. I can only imagine how big is the responsibility of working on the manufacturing on this moment. So thank you very much. It's very good to have you here. So then I will move to Katarina. Katarina, what is your role as a pharmacist?
Hello, Lucas. Thank you so much, and thank you for hosting the Portuguese Young Pharmacist Association here. I would like to start to greet the moderator and my fellow colleagues, panelists, and once again thank the invitation. And we are very eager also to learn from you. We are just starting our active action on international role, so it's very good to have this invitation and to be here sharing best practices, but also getting the best ones from you. So my name is Katarina. I work at in institutional affairs at the National Association of Pharmacies, and my job and daily work allows me to directly support the ones that are actually in the front line against COVID-19. And I'm talking about the community pharmacies and their teams. So my work is mostly advocacy and political monitoring, being it national or international, and investigating the best practices around the world and to exchange them. So if there is something innovative that the Portuguese pharmacies develop, we exchange. So we shared with our international partners. And of course, if we see there's something very interesting that can benefit both the community pharmacies and the patients that they serve, we import it and we share the information with our members. So it's a very interesting dynamic of information that can only result in best healthcare outcomes. So I also create informative content, supporting and promoting the implementation of new and innovative projects that can actually add added values to the pharmacies, and of course position papers. I have some example of margins, of obligation to use the individual protective materials and others. But I also would like to take this point to talk as an individual, because sometimes we are looking for very difficult things to have impact, but I would like to highlight that as individual and as young healthcare professional, we all must set the example on the most basic things that we are advised on. For example, social distancing, hygiene, safety procedures, and even though they might look very, very simple, they are the ones that the WHO emphasizes the most and can actually save lives. Also, I believe there's always something that we can do for our community, or participating in solidarity initiatives and non-governmental organizations. Obviously, in my case, by being part of the board of the APJF, I'm also contributing to support the young pharmacists. But lately, I've been across some very interesting examples on how people use their efforts to support others. And I have actually saw one in social media, and I have copied it because it was so simple and so easy to adapt, and could actually make the difference in my community. And it was so what I saw and what I did was to print and post a very brief message at the lobby of the building where I live in, with a message to our neighbors. So I have some very, very old neighbors, and the message was just saying that if they need, I could pick up some medicines for them at the pharmacy, or get some pharmacy groceries, or get some groceries at the supermarket, so they did not incur in that risk. So there are these very small things that we can do that can have a huge impact. So yeah, that would be my individual role.
Thank you very much. Yes, it's great to see, right? There are these two things working as a hub to bring the ideas to the pharmacists and send the purchase to the others. But I really like this helping the community is helping themselves too, right? So yeah, it's really great. Thank you very much for this introduction. So last but not the least, I want to invite Sylvester. So Sylvester, what are you doing nowadays for the response? The floor is yours. Sylvester, I cannot hear you.
Is it clear now? Okay, yeah. So I would start by the little things that I do as an individual in response to the COVID-19 pandemic. So the basic things that I do is improving my hand washing, trying to tell people like to take precautions and for people to practice the physical distancing everyone is advised to do. And of course, personally, I stay at home, try as much as possible to maximize my time at home. I take some time to study, to also connect with friends online, and ensure my mental health is in check. So as YPG Africa, as you know, it's a project that's ongoing, and we are still like in the pilot phase of forming an organization. So we don't really have a coordinated response to COVID-19 at the moment. However, various organizations that are collaborating to form this YPG Africa are doing tremendously well locally. I can mention some of the interventions that Young Pharmacists Group involved in this project are doing. For example, in Nigeria, Young Pharmacists Group are involved in scaling up the production of hand sanitizers, and they've been involved in engaging the community to let them know about the pandemic and ways they can prevent the infections. So there are other interventions that young pharmacists are also involved in, especially those at the front line, the ones working in the community pharmacists and those working in the hospitals. So in the hospital, we have young pharmacists in Africa being involved in interventions, clinical interventions, such as trying to offer advice on which drug should be included in the protocol, and advice on adverse drug reaction, and so on. We also have young pharmacists being involved in research, in clinical trials, and in providing herbal remedies. For example, in Zimbabwe, the current chairperson of YPG Zimbabwe, Mr. Shepard, is working with the Pharmaceutical Society of Zimbabwe on a clinical trial procedure and a way of finding herbal remedies that are cost effective for people to use to like boost their immunity and help in the case management of COVID-19. So
yeah, and I think it cut, but thank you, Sylvester, for sharing your and other young pharmacists work in Africa. There is something important on what you say that I want to highlight is that, okay, we have the pharmacists who are in the front line and who are doing different kinds of work, but there are also the ones who are more linked to what Katarina said. They are in the community, not necessarily on the front line or not even necessarily employed now. And still, as a pharmacist, we have our responsibility with the community and with the society that we live. So by coming here to this webinar, we all learn, we all have the chance. So it is this important part of being a pharmacist to see your part in the society working. Well, now I'll go then for the second question. Okay. So you all are from young pharmacist organizations, and surely we all want, as an organization, we want to do this response, right? So I go first to Alton. So tell us more about the work of the Asian organization. I think your microphone is on. Hello, Andre? Still muted? Let me see.
Okay,
Fine.
thank you very much. Yes, coming from Asian Young Pharmacists Group, we all know that the COVID-19, this pandemic, is started in our region. So of course, from the beginning, we have a very high concern. And since the first, the outbreak was in China, so the first one that have a very high concern is our member from Hong Kong. So in the beginning, we try to have a lot of discussion and what can we do to help them. In the beginning, they need like PPE and stuff like that. But then later on, we keep seeing that the outbreak is not only in that area, but now also going to some of our other members, so like Taiwan, and then Singapore, Malaysia, and so on. So then, of course, with that situation, since this is really a new disease and that nobody knows what is the severity of the disease, some people said that the mortality was only 3%, but we are looking into something that basically a lot of unknown there, and there is no guidelines, no treatment and stuff like that. So coming from there, so we see that each of our member organization, they do a lot of things in their country. So then the first intervention that we do is to have an online platform, so country experience sharing, because it is very important for us to learn from each other, because we know before this pandemic there was SARS in 2003, like that. So then also coming in our region. Our region is the most affected from previous pandemic. So coming from there, our members countries, they already had experience, so they know exactly what they do. So from there, we have the online platform to share what their experience and what they're doing now. From there, then we continued with some other online platform to answer the needs of our member. The first one, when we learn about the member experience, the country sharing, we know exactly what other countries doing. So we also learn and try to do it in our own country from the young pharmacists. For example, Taiwan has done a lot of excellent works on the educations, and as well as how the pharmacist in the pharmacy has become very active in temperature checking, and also what they have to do. So then people without that have chronic diseases, they can have enough medicines without coming back and forth to the pharmacy. That kind of management is very important. So we learn from Taiwan. We also learn from Hong Kong how they do educate through various ways. They also have the spatial bands to know who are people that are being observed and stuff like that. So and then also we know that South Korea is doing every 2 days they have to report to their government their symptoms and stuff like that. So we learn from each other to help what we have to do as a young pharmacist. Not only that, knowing from that discussion, we realize that we have all the same concerns about having not real idea about what kind of treatments that we have to give. Because as pharmacists, we have to support the frontliners as well. The availability of drugs and about the use and the interaction of the drug interaction. So then we work together with MIMS to provide the information about the repurposing drugs that are available in our regions, what kind of about the dosing, about the clinical efficacy or evidence that are available, even though it's not in the big clinical trials, but at least there are some science that we can stand on, because we cannot give something that is unclear to the patients. So and also from there we always have the country sharing, because this is a new thing. Every country has their experience, so we want to collect that information. So those are the main intervention that we do. But not only that, of course, we also do some other things. We also do campaigns like washing hands. We also do some campaigns to unite everybody to work together, to stay at home. And also we also make some statements to make sure that our member countries, they also have the same concerns, and they also do our suggestions about working together with the mother organizations or the professional organization to support the government as well. So those are the key things that our AYPG do. And then in the next few weeks, we are going to have more online platform as well, because we also see some other issues that we would like to bring up that has to be addressed in our region. Thank you.
Thank you. I want to share with you, Audrey, when I was preparing for this webinar, I went to see the work of the Asian pharmacist group, young pharmacist group, and I was really impressed about the materials that you are developing. So there are the statements, but I have seen trainings, I have seen forums, I have seen many things, and it's great to see how the young pharmacists, they are motivated not only to join and to be an observer, but be an active part of building the knowledge, building the discussions. And young person, I was like super happy to see this work. And for me, the great question is what is the secret? What do you think that comes from your organization that makes you group so motivated and so much willing to build new knowledge and build new things? What's the secret? Tell us.
Okay. Thank you for the appreciation, Lucas, and also well, for AYPG, I can say that the only thing is only one key for us, because we are family, because we are one pharmacist family that stick together. We just see the needs that we have, and we're just addressing the needs. Actually, everybody just come up. This is our idea. This is what we want to do, and everybody just do it by themselves. And then with all the connections that we have, the networkings that we have, and then the capability of our team itself, then in the end, this is what we have. So big applause is for all the team and all the family members in AYPG.
Yes, it really deserves a big round of applause for the work. Thank you very much. So now I will go to Catarina. So tell us, what are the young pharmacists from this group from you from Portugal doing for the response?
Thank you very much, Luca. So just to give you a bit of a context, in Portugal, 40% of pharmacists are with 35 years old or less. So we are a very, very young profession here. So as such, we feel this increased responsibility on the student professional transition, and obviously to take an active role, not only advocating for the pharmaceutical youth, but also in highlighting the crucial role all the pharmacists have every day against obviously this sanitary crisis, but also in their day tasks integrated in the health system and complementing the other healthcare professionals. So for that, we believe that, and it was the first step of our discussion, we had to create bonds and we had to walk together and team up with the Portuguese Pharmaceutical Society, obviously, and with students' representatives. In this case, it was, for example, the National Association of Students. But also taking into consideration the current situation, we are choosing the more efficient, or we had to choose the more efficient way to communicate and to get in touch with our members, of course, but also with the general public. So we really were out of options instead of the digital and social media. A bit to give a lighter mood and to bring some positive insights to the public and to healthcare professionals and to young pharmacists, we decided to share more positive posts that can actually boost motivation and inspiration. And we started by launching a campaign where we have our full support, gratitude, and appreciation for our heroes, in this case, obviously the pharmacists, but not only, all the frontline workers that are providing sometimes even their health to assist the people in their population. Also, we have tried to come up with different and appealing posts on our social media, such as content, videos, and testimonials from young pharmacists working in different areas, from community pharmacy, hospital, pharmaceutical industry, distribution, academia, from different areas, not only from Portugal, but also young Portuguese working abroad. And we believe that this is the way that we can show to other members what has changed recently, how they envision the future, and it can actually be very enlightening for people that do not know that setup. Obviously, and it's also part of my work to share the best practices from our fellow colleagues around the world, and also from youth initiatives, from faculties, and even from students. Something that was very important was something that the Portuguese Pharmaceutical Society has created, which is a kind of a platform for volunteering. And we believe that we had to mobilize our efforts to help when they needed. For example, I now remember very known opportunities that was volunteers for hospital pharmacy, and volunteers for a recently created pharmacist support line that is to help. It's a tool, a telephone tool created to answer pharmacists all the questions that they have on the pandemics, on the legislation, on the restrictions, and now on relaxing measures. And I have to say that young pharmacists and soon to be young pharmacists joined this initiative very much. Something that we also do is that we have noticed, I mean, we all have noticed there's a lot of information out there, a lot of information, sometimes not from so much reliable sources, and we try to filter it a bit for our members. So sometimes we filter what we believe is from the best interest to our members, but even after that, sometimes it's so complex, sometimes it has so much bureaucracy that we break it down into a more visual and easy to get data. We also believe that the training and education and continuous professional development cannot stop, cannot stagnate with this, and only on the contrary. So with many webinars and for free that there have been, hopefully, we have created a special section to share and promote them. We all almost every day we have some content there, and I can reveal you that it's also part of our future plans to organize one. We also took measures to ensure that our members would only focus majorly in their tasks. So we have this decision of delay the request for membership fee, because we believe that it was not the time, and we would like our members not to worry about that. So it was delayed, and we believed it was a very important measure that could also support our members. I mean, in the end, the most important thing is to achieve what it is actually our core mission, which is to grant access to access to health and safety to the patient. And with this unified approach, it can only bring benefits and health outcomes to our patients, but also to the valorization of the profession.
Thank you very much, Catarina. You, as a Brazilian, we share the same language, so I follow everything out from Portugal. And I have to say, I really like to see the social media, especially because it's exactly what you say, to bring the best quality and the best practices on the field. So you see there the WHO, you see there the Orden, the Organization for the Professionals, and always on the point. And also now on the Instagram, also some pharmacists showing their work. So it is really great to see. And for me, that this part of the volunteering also caught my attention. I didn't see this in Brazil, but I saw in Portugal. So it was very nice. So I want you to go a little more on this. How do you see the reaction of the young pharmacists to what you share? Not only on the knowledge, but like on this information about the volunteering and the new platforms. For example, you share the training from WHO, the 1 hour training from WHO in your social media. So do you see the young pharmacists being active on what is shared from your side?
Yeah, thank you for our question. Well, happily, we have been having great feedback from our members. I also tend to notice that it's like sometimes young pharmacists have this, they have more availability also to come up with this solidarity actions. I also believe it's part of the DNA of a pharmacist to actively enroll in these activities and to assist and to, as a team, to help to support whoever is in need. But so far we have been receiving very good feedback, not only from the young pharmacists, but also from the students. Because, for example, something that is happening here, some of the traineeships that they need to conclude the masters, they are suspended, and even with their traineeships suspended, they still want to engage, and those are the ones that mostly enroll in these activities. So it's very good.
Wow, some great, so good to hear, right? Okay, I will pass now to Sylvester to tell us a little about because you told us about what you are doing and what other young pharmacists are doing. But I want to know now about your organization, the African Young Pharmacists Group. How are you intervening on the pandemic?
Thank you very much, Luca. So I would speak again on, because YPG Africa is a project, and we are creating an organization. So the pandemic has really like affected us, and we are trying as much as possible to adjust to the outbreak of the pandemic, and a lot of activities we planned for the year actually changed. And looking at the organizations that are collaborating to form this YPG, this African YPG, PSN YPG, YPG Sierra Leone, YPG Zimbabwe, YPG South Africa, young pharmacists from Ghana, from Malawi, from Kenya, from Rwanda. We are like saying, okay, we plan previously to have a conference this year, and we wanted to bring all young pharmacists together in Africa. That was our plan. And this conference was supposed to be in June, but because of the pandemic, we had to adjust our planning and try to check if we can bring all young pharmacists in Africa together through a virtual conference and accelerate the pilot phase of the project so that we can be united and have a well-coordinated organizations that would further advance the whole vision of YPG Africa. So as young pharmacists group in Africa, what the various countries, member countries, what they do have been really inspiring, and nationally, a lot of pharmacists are going beyond the front line, and going beyond the front line, considering the peculiarity of Africa as a continent and what Africans need at this time. As you all know, you would agree with me that Africa, we have resource limitations. Resource limitations in terms of knowledge. There's a knowledge gap in Africa. There is less access to resources as well. And so young pharmacists in Africa, that is through our member countries, they are going on the front line, protecting other healthcare professionals by providing personal protective equipment in various countries, and also going to the communities for patient education, letting them know about this virus, and also providing relief for people in vulnerable communities who cannot afford to feed during the pandemic. So it's like this is like a big time for young pharmacists in Africa to speak up, to come out of their comfort zone and reach out to their communities. Meanwhile, as a project group, the Young Pharmacists Africa initiative continues to progress, and we continue to unite the efforts of all pharmacists in these various countries to respond to the pandemic. Yeah, thank you.
Thank you very much, Sylvester. I imagine that creating an organization in the middle of everything that's happening is some really special challenge for anyone. And I hope that from some of our participants, they are also thinking about creating their own YPG somewhere in the world. So, and maybe some of them want to start now. So what would you highlight as the special difficulty that the pandemic brings? Not only the difficulty to get together in the physical place, but do you see some other highlight on this creation process?
Okay, so what I would say really is that people should not see COVID-19 as an obstacle. So I read a book recently. The book is titled "Obstacle is the Way," and I read this book during the pandemic. And one lesson that I learned from the book is that when you see obstacles, you take advantage of them and leverage on the opportunities that those obstacles can present to you. So I would really advise people like thinking of creating young pharmacists group, either nationally or maybe young pharmacists forum locally, that they should not see coronavirus, the COVID-19 pandemic as an obstacle, because yes, there is physical distancing. You don't get to meet people one-on-one, but there is no there is no, like, coronavirus does not have any impact on social interaction. So people should like recognize that fact, and there are various platforms that can be quite useful. We have social media. You can communicate through the internet, and as long as communication is effective, creating a young pharmacist group can be possible. Although it might affect the registration, but where you bring young pharmacists together and then you try as much as possible to establish a vision that everyone are a part of and can key to, I believe that they can really sustain that motivation until we all come out of COVID-19 pandemic. So it's a question about if this is a vision they really see, if it's something they really want, and if they believe that young pharmacists should come together and work together in their communities to create that change that they want to see. And as long as communication is possible,
I could not put it that myself. That's really put what the others say. Create a vision, motivate. This really brings everyone together. Thank you, Sebastian. So, the last but not least, Ahmed, what is the YPG from Middle East doing, or Eastern Mediterranean doing?
Okay, thank you, Lucas, for your question, and I'm really inspired and delightful to hear from my colleagues here, bright game changers who are doing great jobs on their regions and their countries also. So I will take you on a little bit different path, where I'll be speaking to you about young pharmacy students and recent graduates who are parts of IPSF and specifically in the Middle East region. So in this region, we have those students who are still like being in the lockdown in their homes, and maybe they have tests, they have some external stressors, but despite all of these, they united together as 14 countries and 20 associations to bring the best out of them, to educate the public, to educate themselves, to educate their colleagues, in order to make this period to pass as smooth and as successful as possible. So in the EMRO region, I'm in always close contact with the current regional working group, who created in a collaboration with a member organization what they called COVID Magic Box. And in this box, they provided materials that can empower their association's knowledge to exchange ideas and establish this platform of sharing what each country is doing actually. So in this magic box, they have this the CDC report, for example, the Center of Disease Control and Prevention in the United States, which always promote educational materials and implementation of mitigation strategies for the communities to prevent the local COVID-19 transmission. Also, they rely a lot in this magic box on FIB report, like health advisory report, that dispel all the myths that are being circulating around the communities. Also, they provide materials about pregnancy and COVID-19 and what to do as you are the pharmacist in the making, pharmacist in progress. So how you can advise your relatives, your community about this in collaboration with physicians. Also, they have in this magic box the latest articles for the treatment and research about all the empirical treatments that are being studied on patients, as Audrey was just referring to, in the manufacturing field. So there was a plan also to design a forum, online forum for these young students and recent graduates to discuss those trials, to try to understand how we can apply them professors and researchers, how we can apply them to our clinical practice as well. And definitely include also educational videos from the World Health Organization and also some online courses from WHO as well. Not only that, also the member associations, we have some examples from Algeria where they presented some awareness videos made by the students and the members of their associations to the public and to their colleagues in the Middle East region and around the world. Series of webinars, newsletters. Also, I liked one idea. It's called the Green Challenge, where they were asking people to donate face masks to the cleaning staff in hospitals, also where they have shortage of resources, and other online campaigns. Also in Lebanon, for example, they had this quarantine tips series where they asked many professionals in the pharmacy, in the medicine, in the nutrition, in the sport, in the mental health also, to provide some tips to the public about how to cope with this pandemic also. And also we have into Tunisia, for example, where they did something really funny, but it's something also creative. They called it quarantine party online. So they gathered their member from the association in Tunisia, and then they interact with each other in order to establish within them that despite the distance, we need to bring joy into our lives as well. And we need to take care of our minds in order to survive it and prosper after it also. In Jordan also, they had some educational brochures, and I've seen this also in many of the Emirates countries, where the School of Pharmacy, they provided their students, and I was also honored to be one of those, like in my country also, to assess the students to design educational brochures for the public. And also their professional development team in Jordan association, they created a platform on WordPress to provide students with beneficial and entertaining material to develop their skills and expertise while at home. Thank you.
Thank you for such a great overview of this Mediterranean region. And I think you, and somehow also for Sylvester, you are in two regions that we have emergency, humanitarian needs. So even myself, I work for Yemen. So it is a place that sometimes the resources that we have, like being here and watching a webinar, is limited, sometimes not even possible. So how do you see the active, what can the young pharmacists do in a situation like in an emergency setting? How do you see this possibility?
Definitely. So emergency preparedness is a topic and field on its own that every healthcare professional and humanitarian activist need to understand and learn and acquire the tools to master this field and help the public. So I will take one example from Iraq, one of the Middle East countries. As you know, it was also suffering from revolution and some security instability, etc. problems, and then came the COVID-19 to also place another burden on the country. So for example, in Iraq, they have what they call WHO Iraq country-specific preparedness and response plan against COVID-19. In this plan, they have the International Organization for Migration, which has branch in many countries, IOM. They were focusing, and we have also young pharmacists who are contributing to those areas of focus. So they were focusing, for example, on coordination and partnerships with many other institutions and organizations within Iraq and in the region and in the world also. Also, they were tracking the communication and community engagement, doing that education, dispelling all the myths and rumors about, for example, the medications that that they may use without prescription. So going actively and proactively to the community to educate them about these facts, and that they should be only used in specific situations actually. Also infection prevention and control, also education and implementing policies. We have many hospital pharmacists who were, as part of the Young Pharmacists group also, who were establishing policies in the hospital to, from their perspective, to prevent transmission from one floor to the other, also, and from one, one institution to the other. And last but not least, the camp coordination and camp management and protection. You know, we have a lot of refugees, we have a lot of humanitarian crises in this country and the region. So part of that report and that plan in Iraq, they were talking about and gathering all the resources to target the camps, because these camps can be a special focus for COVID-19 to spread. And if we don't really contain it, it will go out of control. Thank you.
Thank you very much. Our time is almost up. Is up actually. So I will actually, from what we talked here, I could see pretty much the answer for the last question, right? So which are the materials? So I heard here many acronyms. So we heard WHO, we heard IOM, we heard the Portuguese Association of Pharmacists, FIP, you heard many of them. So is there any other source of a material that you would like to add? Is an open question for everyone. No? Okay, so as our time is up, some people already gave us some questions, and they will be shared on the email. So I will give a chance for everyone to do a final speech, so you all can share what you want to keep. Okay, so I will give first. Let me see. Sylvester, do you have any final words? I don't think so. So I will move to Katarina. Which are your last words for the public?
Yes, thank you so much. First, I need to thank again this initiative, because it's very inspiring. The variety and the variety of initiatives that are being taken around the world from young pharmacists. So I noted so many down that it will be part of our reference in the future for sure. And as a final message, I would just like to say that if there is anything or one thing that we have learned along this sanitary crisis, is that things only started to improve, like the so-called bending the curve or flattening the curve, when everyone united forces, being the government, being the media, healthcare professionals, general public. And it was impressive to see so many entities teaming up on the same goal. So complementarity of the health system, benefiting the patient and mitigating the virus. And I completely agree with Sylvester on this. There are so many opportunities that have risen to pharmacists. I can give you an example. In Portugal, like there was this pilot going on dispensing hospital medicines in community pharmacies. And it was happening already for 2 years, and it included few hospitals. And suddenly, after 1 month of implemented because of this crisis, the green light operation now served 9,000 patients in more than 30 hospitals and more than 2,000 pharmacies. So it was huge and it was really, really impressive. So we should always keep in our minds the huge assets we have, which is the trust of the population and the quality of service. And the new normal, as it's called now, does not seem to end soon, and we must adapt to it as soon as possible. And the pharmaceutical profession can only get stronger from there. And if you allow me, one last personal note, I would like to share with you some thoughts that actually it was my younger sister that she's studying pharmacy. She shared with me, and it makes me think a lot, which is we are now living very, very different times. I'm sure our children and our grandchildren will ask about this. So what would we like to tell them? What we would like to tell them that we have accomplished? So thank you very much. And we were very glad to participate here. Thank you.
Thank you very much for this last message. I will go for Ahmed. So any takeaway messages?
Yeah, just one last message to all the wonderful audience here. Thank you for your time. Thank you, Lucas. Thank you, FIP, YPG, for this, amazing initiative to bring like-minded heroes together. I just want to say, it may look stormy now, but it can't rain forever. Stormy times are the ones that bring the best within you, only if you decided to do so. You see yourself, you have all the tools, you have the home, the family, the friend support, the education, the excellent health. So what are you waiting for to do the act of service for others? It's only your willpower to do so. And always remember that compassion is your main motivator to serve the world. God bless you all, and thank you so much.
Very much. Audrey. Yes,
Thank you very much. We have wonderful panelists, very impressive with all the final statements. I don't think I should add more, but there's one more thing that very important for us to remember, that this virus, it knows no race, it knows no boundaries, so everybody is affected. So again, just like the virus is affecting everybody, we have to stick together to combat this disease. We cannot stand alone. We can see from all around the world, everybody is standing with their own way, but now we have to gather together with FIP. I think as one world, as one young pharmacist, we can do a lot of things more, learn from each other, do things together. And again, I agree with Katarina that there's something that, what do we want to accomplish? Then when we accomplish, let's accomplish together. If one area can overcome the issues, then we all can overcome the issue. Because if one area or one region cannot overcome, that means we are all lost, because we are here together. And one more important thing is we have to stand on the science. So we cannot decide on what we think or what we feel, but in all the decision that we take, we have to base everything on science and evidence. And I hope that all young pharmacists will read a lot, will learn a lot with all the pharmaceutical sciences that are moving very fast nowadays, and then implement it wherever we are. Thank you.
Thank you very much, Audrey. Thank you very much, all the panelists, for joining us. Thank you, FIP, but also thank you to all the participants who joined the webinar. We're all part of this response. And we all together can beat this pandemic, I'm sure of it. So thank you again, everyone, and stay home, stay safe. Thank you very much.